A glucometer, also known as the blood glucose meter, is a medical device which works by measuring the concentration of glucose levels in a small sample of blood. And the step-by-step process includes of firstly you need to prick your finger for the small amount of or small sample of blood by using a lancet. And this is a strip which is made up of plastic and it is disposable. And then this strip consists of the glucose oxidizing enzyme, which is nothing but glucose oxidase. You need to place your sample on this strip. Then the glucose that is present in your blood reacts with this glucose oxidizing enzyme glucose oxidase and results in the formation of gluconic acid and hydrogen peroxide. And then the electrode detects the electrochemical reaction and the glucose levels are detected on this glucometer. What are the normal blood glucose levels? In case of normal, that is in fasting stage, it should be less than 100 mg per deciliter. In case of after meals, it should be less than 140 mg per deciliter. In case of diabetes, in case of fasting stage, it should be 126 mg per deciliter or higher. In case of after meals, it should be 200 mg per deciliter or higher. To know about the content, please download our Prakara app, like, share and follow our Insta page and also subscribe to our Prakara YouTube channel.